I'm Chris Favilla from the University of Pennsylvania, and I presented on a concept called infarct density, which is a novel imaging biomarker of long-term functional outcome after endovascular therapy. And the crux of this project is that I think as most of us recognize that infarct volume after thrombectomy is partially informative of long-term outcome, but does not tell the whole story, right? Several of the landmark endovascular trials failed to even recognize a significant difference in infarct volume in that post-thrombectomy imaging, right? We're really focusing on that 24-hour or so post-thrombectomy MRI. Our group recently developed this novel metric that we're going to call infarct density, which is sort of an ADC-based metric that really looks at really low ADC values within the bed of the infarct. You know, that measure of the depth of infarct or severity of infarct seems to have be somewhat informative of long-term outcomes. So we developed a sort of an automated processing, leveraging really the rapid automatic processing pipeline to look at the ADC threshold less than 470, which in prior work we've recognized as being particularly informative threshold. So this metric of infarct density really quantifies the percentage of the total infarct that has that very low metric, right? So if you have 100 cc infarct and 50% of it is below 470 by ADC, then that would be a 50% infarct density, for example. And what we found is that this metric, this automated metric that we can calculate very easily through rapid, is independently associated with long-term functional outcome. And not only that, but it's actually more informative than infarct volume alone. So even when we add it on top of a multivariate model that includes a range of baseline clinical variables and radiographic variables, even when we add infarct volume into the model, adding this new metric on top is independently informative and, again, even more informative than volume alone. So our hope is that this is not only a potentially really valuable resource for prognostication after thrombectomy, but may also really serve as a critical sort of surrogate biomarker or surrogate endpoint, rather, for early stage trials, right? If you're developing an adjuvant trial or a neuroprotectant, this may actually be a more robust outcome measure than infarct volume alone for your early phase study.